We are just hours away from a potential government shutdown, but what won't be shut down is the rollout of the Affordable Care Act tomorrow, better known by many as Obamacare. Despite the major launch, many Americans still have questions addressing that very issue. This month's Essence magazine includes a report called Mastering the Healthcare Maze. So we brought in Tanisha Sykes, who is the magazine's senior editor of personal finance, to explain it all to us. Welcome to Arise America.
Thanks for having me, Debbie.
You know, it's all anybody can talk about beside the government shutdown is the rollout of this, or the enrollment that opens tomorrow, the Affordable Care Act. So let's start with who this enrollment actually applies to.
What people really need to think about is for the Health Care Act, this is for anybody who is uninsured, who is underinsured, and this is also for people who are really thinking about, you know, do I have the best plan for me? And they can compare and contrast, for example, small business owners. And so really the real focus today, what we should be really thinking about is those uninsured Americans, specifically 6.8 million African Americans out there who are currently uninsured.
Yeah, and the truth is that the enrollment is really for a very small segment of the population.
Yes.
So let's talk about who doesn't need to worry about the enrollment.
Absolutely. So the people who don't need to necessarily worry are the people who already have the insurance. So if in fact you have insurance, you should have received something from your company that said, yes, we have the insurance and we meet the Obamacare mandated federal guidelines. So either what we have meets it or it exceeds it. But you definitely want to make sure that you know what's happening right now, because what's really important, people don't understand, whenever it's new, it needs to be explained. I think that's where some of the confusion is coming at.
And of course, you know, there's many voices out there that are saying it's too complicated, it's going to bring, you know, civilization to an end about that. So for someone who is not insured, and this is their chance to get insurance, what do they do tomorrow?
What they do is go to healthcare.gov and they can sign up. Anybody who has had a job and you've had insurance, this is open enrollment season. So really think about it like that. And the good thing is you have from October 1st to March 31st, 2014 in order to enroll. But if you want the insurance to kick in January 1, 2014, sign up now if this is something for you.
So let's just give an example, and it's so hard to gauge how much it costs because it really depends on who you are and how much money you make and what state you're in, blah, blah, blah.
It really does.
But you've come up sort of with a general examples.
I have, and so I went on to KaiserFamilyFoundation.org and I went into a calculator, that you can use for the Health Care Act. So a family of four earning $40,000 a year, and this is what their numbers are. The unsubsidized annual health insurance premium, what it would cost if you didn't have any health care but you wanted to be a part of this plan, would be $9,700. But you get a tax credit from the government, so that takes away $7,700 and it leaves you with what you're going to pay, which is approximately $1,900. So that's your out-of-pocket care. $1,900 for your premium breaks down to $165 a month. And that's
really
what people need to be, you know, aware of. Exactly. So be aware of that. So you can go to kff.org and put in your numbers. It popped out for me in 1 minute or less.
And of course, what is so important, and so many people have talked about this, what really is going to make this bill work, this law work, is for young, healthy people to be a part of. Sort of explain that.
Yes. And what it is the good thing about this particular act is you have until age 26, as long as you are under your parents' health care, in order to be able to continue with their health care. But once you turn 27, then you're on your own. Hey, I remember 15 years ago when I was 21 years old at Rutgers University and they said, that's it. And so then you had to go to the local clinic. So now you have 5 more years. That makes a big difference in the quality of care that you're going to receive. And so young people in this economy are saying, well, what if I don't have a job? What do I do? The reality is you still may be eligible for Medicaid. So all is not lost. And the other thing is, because so much of this is being subsidized, being paid for by the government, then they will help you to get to where you need. So there's more than one option.
We're going to have to stop right there, but it's also important to note that there is a penalty for those who aren't insured if they don't choose an insurance. So it's important to go on. Say that website again.
Healthcare.gov.
Healthcare.gov. Everybody go on and see. All right, Tanisha Sykes,
well,
thank you very much.
Thanks for having me.
And you're watching Arise America.